talk a little bit about blood pressure, because I think there's a lot of people out there that think that blood pressure is something they can kind of ignore because they don't really feel it. Or maybe they think that if their blood pressure gets high, they'll feel it. Well, let me tell you this, that all we know about blood pressure suggests that realistically, if your blood pressure is high enough that you can feel it or you have any symptoms, you're probably this far away from having a stroke. The thing about blood pressure is it's a really good idea to know your numbers. And if you have a home blood pressure machine and you do that test regularly and you see your blood pressure looking pretty good, it's probably a pretty good sign things are okay. Sometimes people have really good home blood pressure readings. They go into a doctor's office and their blood pressure's, it's on the high side. And that might be related to a burst of adrenaline that occurs as you go to a doctor's office, because doctors can raise your adrenaline levels a little bit. Happens to me, and I'm a doctor. My blood pressure is always fine at home, and I've got a pretty good blood pressure machine. Even when I measure it myself at my own clinic, it's always in the low end of normal. But when I go to see a doctor, it's usually a little on the high side, and I have to give my doctor some records to prove that I don't need to go on any kind of treatment. So there's always that sort of borderline region. But if your blood pressure is clearly elevated, my admonition is you probably ought to be treated first, probably with some medication. We've got way better medications nowadays than we used to have, ones that generally don't result in any significant side effects, and then maybe consider looking into the reasons why your blood pressure is elevated, because there are reversible causes of high blood pressure. And simply treating the blood pressure when there's a reversible cause is a bit of it's not a backwards way of doing things, but it really doesn't make much sense. So for instance, in our practice, where we deal with people who are sent to us by referral with serious weight problems, they often come in on high blood pressure medications, sometimes 2 or 3 of them, and their blood pressure might be fairly well controlled. And then within a few months of weight loss, we realize they're starting to feel faint when they stand up. And when we measure their blood pressure, it's a little low. Well, guess what? We might be able to take them off a medication or 2, sometimes off all their medications. So weight loss is one of those things that can make a big difference for your blood pressure. And if you do end up being able to come off the blood pressure medication, fantastic. But remember, if you gain that weight back, that blood pressure is probably going to come back too. So don't walk around, with a see no evil, hear no evil, speak no evil attitude about it. Keep your eyes wide open, because untreated high blood pressure will eventually likely result in a stroke. And that is the harsh reality. In our practice, we also see a lot of people with another reversible reason for high blood pressure, and that's sleep apnea. It's perhaps the most serious and underdiagnosed health problem in our country right now, certainly in the United States, especially in individuals over 50, and especially in men over the age of 50. Sleep apnea is a huge cause of high blood pressure. And to me, every time I see a person who's carrying some extra weight and they have high blood pressure, it's a clue that I ought to have them screened for sleep apnea. And lo and behold, if you have that sleep apnea appropriately treated, usually by CPAP, that person will likely end up having their blood pressure come down, often to the point where they don't need medication anymore. In essence, there are definitely reversible causes of high blood pressure, but don't pretend that it's just fine, and just because you don't feel it, all is going to be well. Just not the case. It's pretty clear. The data's been out for a long time that high blood pressure is something that you got to take seriously. There are other dietary things that can make a big difference. There was a big study done years ago using a diet called the DASH diet, which is very similar to the Mediterranean diet in most ways. And that's a diet that, again, like the Mediterranean diet, it seems to benefit people in every respect. And that's one of the ways it can do that. And the main thing is don't neglect this. It's really serious. It's part of preventive medicine, is to keep an eye on serious risk factors, and high blood pressure is right up there with the serious risk factors.